Hello, and welcome to today's episode of The Daily Blend. I am your host, AC, and we are joined in studio today by Jake Rettke, who is the Program Director for Clarity Healthcare. How are you, Jake?
I'm good. How are you?
I am doing fine. Welcome to the show.
Well, thank you so much for having me.
Of course. So, Jake, tell us, for anybody who's not familiar, a little bit about Clarity Healthcare.
Yeah, absolutely. So Clarity Healthcare is a federally qualified health center. What that means for a lot of our folks here in Columbia is that we serve the traditionally underserved community. So those individuals that may otherwise have barriers when it comes to accessing care, whether that be behavioral health care, primary care, dental services, we want to make sure that we get the folks what they need.
Okay, so let's break that down. So you said, is that mental health care, that's primary health care, dental, vision? So give us a little bit of a breakdown.
Yeah, absolutely. So through our partnership with Burrell, we're able to offer a lot of those behavioral health services. Through Clarity, we have a primary care clinic, a dental clinic here in town, and our Scholar Clinic in partnership with Columbia Public Schools. That's only open for Columbia Public School students, and we also offer optometry services there.
Okay, so optometry services. We've heard a little bit about those, but can you just tell people who maybe missed that segment a little bit more about the optometry services?
Yeah, absolutely. I mean, that was a big part of the mission behind the Scholar Clinic, right? If kiddos can't see the board, their scores in math, reading, across the board drop dramatically. So, the ability to get those kiddos in for an eye exam, get them glasses when they need them. We have some funds available for kiddos that may not otherwise be able to afford those glasses. The outcomes are there in the classroom, and ultimately the goal is to make sure that they succeed there.
Yeah, absolutely. So what is the best way for anybody who's listening or watching who may fit that? They may fit that. I'm an underserved person, right?
Sure.
And maybe I don't have access, or I feel like I don't have, maybe I don't have a primary care physician. What's the best way for me to reach out? Clarity just sounds like, oh gosh, it sounds so big.
Yeah.
Because you do so many things. What's the best way for me what's my on-ramp?
Absolutely. So I think the most important message here is that there's not a wrong door to enter our services.
Okay.
We're all about increasing access to the communities that we serve, our community here in Columbia. And so calling any of our clinics, we can get you to the right place. One of the things I always like to talk about, especially as it relates to our Scholar Clinic, is we're not just there for the kiddos, we serve the whole family. So if we were to have a student come in, maybe they're sick that day and they need to be seen. If they don't have a primary care provider, they can establish there at Scholar. As we're talking to mom and dad over the course of the appointment, if they don't have a primary care provider, they can come to our Stevens Lake Clinic and be seen there. And the whole family is more than welcome to come hang out with us at our dental clinic, get the care they need there as well.
Okay, and so where's your dental clinic?
Our dental clinic is over. It's over in kind of that Keene Street Medical Park area, right off Berrywood Street. There's a large Burrell building, and we're in a smaller building right next door.
Ah, okay. See, I don't know if I've had anybody here to talk specifically about your dental clinic yet.
Sure. Yeah, I know my colleague Joe Miller talked a little bit about kind of the beginnings of that clinic. It's been fantastic, especially as we talk about some of that open access, same-day access. If anyone's in dental pain, nothing else really comes to mind as a priority. So we want to make sure we can get them seen that day, get that need addressed, and then ultimately engage in more of a preventative approach to their health care. And that's across all of our service lines.
Yeah, that's very true, because I will tell you that same day, the dental pain, that being able to access that same day, that's very, very important for
Absolutely.
folks. And if you don't have someone that's like your primary dental where you can call right away, sometimes it just feels kind of helpless.
Absolutely.
If you're in pain.
And we find across the board that especially for that Medicaid population that we serve, a large percentage of our patients across Columbia, that same day access is crucial to making sure that they're able to start on the road to more preventative dental care. And
so that would, like you're saying, that would carry across the board then for most of your services.
Yes.
I mean, the mental health services, that seems to be the recurring thing that I've heard, because we have you guys come in to talk about all your different services.
Yeah.
So that seems to be the recurring theme.
Yeah. I mean, I think we get paid to work in this healthcare system every day, and I'll be the first to admit that it can be confusing. And so for someone in the community to take that first step, I think we do a great job across our system at recognizing how monumental that is and saying, we're ready to move at your pace now, but as quickly as you want to be engaged in services, we're here to make that happen.
Okay, so let's get a little bit of clarity about clarity. You see how I did that? Get a little bit of clarity about clarity. So if somebody is listening to us now, are they looking up Clarity Healthcare? Is that what they're going to be looking
Yes.
up? Okay, so they can find you by looking up. Tell us how to find you.
Clarity-healthcare.org.
Okay.
Or if you Google Clarity Healthcare, dental primary care will come up there as well. I always encourage, give us a call. We can give you a quick answer on when we're able to get you seen.
Okay. Okay. And so I want to make sure people if anybody's tuning in late or if anybody's just catching up, this is Jake Rettke, and Jake is the program director with Clarity Healthcare.
Yes.
And you guys are providing mental health care services.
Through our partnership with Burrell on Behavioral
Partnership with Burrell, as well as you guys have optometry services through...
With Columbia Public School students, we offer optometry services, glasses for those kiddos that might need them, and some vision therapy services to hopefully reduce the need for corrective lenses down the line.
Okay, and some primary care.
Yes, primary care for Columbia Public School students as well at that Scholar Clinic. And then at our Stevens Lake Clinic, we do primary care for anyone in the community.
Okay, yeah, that's a lot, all kind of wrapped up in there. And I know that it can get a little bit confusing for people, but what I want to make sure that people know is this is for our underserved population.
Absolutely.
Which is where these kinds of services are really needed the most.
Absolutely.
Because, we have people who live in our community that need these services pretty badly. Let's just keep it real here.
Yeah.
They need these services pretty badly. And to have a number that they can call or a website that they can look up and say, you said something very important. You can give any of these phone numbers a call.
Yes, there's not a wrong door to get connected with us.
Okay, so anywhere we call, when we reach out to Clarity Healthcare, they can say, you may not be talking to the right person right now, but I can get you to the right person.
Exactly. Right? We may not know the answer all the time, but we know the person who does.
See, that's always the right answer. That's always the right answer. The right answer is always, I may not know the answer, but I can find somebody that can get it for you.
Give me just a minute. Yeah, give me a minute. I'll find it for you.
That's wonderful. Okay, give us the website again.
clarity-healthcare.org.
Okay, clarity-healthcare.org. That's for our radio listeners. Write that down. Remember it. If you're looking at it on the screen, take a picture of it, screenshot it, pass it on to your friends who need it, because there are people in our community that could be served by this every single day. Jake, thank you for visiting with us. We always appreciate when you guys are here with us, because this is information that our community needs every single day. We appreciate you, and you look sharp, my man.
Absolutely. Thank you very much.
I appreciate you being here.
Thank you.
All right. We'll see you next time. And man, your socks. I miss those.
Yeah.
I miss those. Thank you for being here, Jake.
Thank you.